Hey everybody, Dr. Daniel Klauer here from the AACP talking about this year's annual meeting. I have Dr. Eric Phelps, orthodontist from San Jose here. I'm going to jump right into it. Dr. Phelps, who are you? What do you do? And give us a little bit of your background and training.
I've just finished 20th year of private practice. Dental school, UCLA, finished in 2001, and then stayed there for ortho, finished in 2003. And so now we're in the 21st year. So I started from scratch in San Jose. My classmate from dental school at UCLA, Jason Cohen, joined me, I think 2005. And then we've been developing our practice and protocols over the years. And after seeing you speak in Tahoe at the Ormco meeting, started studying breathing. And that was 2018.
Yep.
So it's been 6 years studying breathing. It's made life work more interesting, more exciting, but also more challenging for sure.
Ortho was probably easier before 2018, huh?
Well, you know how people like to say orthodontists have it easy. They just walk around and watch people do all the work. So,
Yeah.
but when you take ownership of how people breathe, that's a heavy responsibility. And if you take that seriously, which I take pride in doing, it's a lot of responsibility. It's difficult.
Well, we're excited for this year. Dr. Anil Rama, Jason Kiefer, buddies, colleagues, and collaborators of yours, you help orchestrate them to get them to the meeting. They shared a little bit about what they're going to show us. But if you were to give a high-level view of what you're going to talk about, what would that be? And then what is something general dentists can show to their orthodontist to get them excited to come hear you speak at this year's meeting?
Oh gosh. Well, I'll just start with a little history. You called me one time and said, Eric, you going to the AO winter meeting? It's the first AO meeting on sleep apnea. And I said, no. And you said, you got to go. Dr. Guimeno is going to be there. Okay. So I go. And then that was an eye opener. That was an eye opener. So Dr. Guimeno in his 90s, battling cancer, which we didn't know, he didn't disclose that, flies across the country and gives an amazing talk. And I've listened to his recording probably 7 times. And every time I get something out of it, but I had to learn more. I had to treat more patients to really understand half of what he was saying. Right. So I feel like I have a pretty good grasp of it now. And to see the pushback that he got even at that meeting, the way orthodontists got up and spoke after him with really a lack of respect and a lack of appreciation. So what I want to share is this divide between medicine and dentistry. And the title of my presentation is 3 Heart Failures, Nasal Valves, and Alpha Bands. Mm-hmm. So the 3 heart failures are the things that we've learned from 3 heart failures in our family. One causing the loss of our son, Dane, my wife needing a heart transplant, and then myself having heart failure where I wasn't given all treatment options.
Yep.
Right? But with my wife, for example, she went to the cardiologist for years saying something doesn't feel right. And he says, you're a hypochondriac, you're fine. You need to spend more time with your husband. And then sure enough, we're on vacation in Hawaii and her heart rate goes over 200 and we get back and he does an angiogram. Well, the angiogram looked fine, but yeah, there's something really going on here. So I asked him in the basement of the hospital reviewing the angiogram, he says, well, the angiogram looks clear. And I said, well, doctor, I remember there was one time somebody mentioned that she had something with her septum, a little leak or something. And he says, you're the dentist, I'm the cardiologist. Basically shut your mouth, stay in your lane, right? Well, that's what I realized now happened at the AAO winter meeting. There were orthodontists that got up after Guimeno spoke and basically said, Dr. Guimeno, you're a sleep physician, stay in your lane. Don't tell us when to expand, right? Yeah. So I just want to share that message because there's so much to be learned from the interaction between medicine and dentistry that has to be solved, and it goes both ways. Yep. It's not just the physicians discrediting dentists, it's also dentists discrediting physicians. And so I want to speak to that. And then the next part is nasal valves. Started learning about airway from you, from Dr. Olmos, started really studying. And when Dr. Guimeno showed a slide saying my biggest regret is the AHI, you need to study flow limitation. So I started studying flow limitation. And I realized that the nasal valve is the most overlooked part of the airway anatomy. And then to alpha bands, Dr. Rama got to meet Dr. Kiefer, and then he introduced me to Dr. Kiefer. We started co-treating patients. And Dr. Rama said to me one day, he says, Eric, you're improving people's brain function.
Yeah.
And I said, what? What does that have to do with orthodontics, right? But sure enough, when you start looking at brain maps and alpha bands that I'm sure Dr. Kiefer will speak to, and I'll show some of the stuff that we have, some of the data, you're improving the way the brain's functioning. And we have diagnostic tests to confirm it, but then you also hear from the parents, and then you also see the kids' school performance and the quality of life.
And to the physician's defense, we didn't really have a good option for the nasal valve as of late, right? You know, we had some crazy cartilage procedures that were very tasking, and then now thankfully we have like Vivair and now MSC and or MMA. So like the tools we have for the valve now have not always been there. So that's also, I think, going to make it easier to notice and then treat.
Yeah. So we have, in orthodontics, we have static records that I'm calling it, right? In the past, it was Pano, Ceph, study models, photos. Now we have dynamic records, and we can show you with rhinomanometry, with sleep studies, with brain mapping, how things are functioning, which is really irrefutable,
We're excited to have you. I think it'll be a phenomenal talk, a lot of good camaraderie, energy, and learning across both ends of the spectrum, from physicians to dentists and dentists to physicians. If you have one last piece of advice for a fellow AACP member to get a colleague to join, what's maybe a hook that got you to come to the first AACP meeting, or something they could say to a colleague to say, hey, I really, really want you to be there for our relationship, our community, and our patients? What would you encourage them to say or do?
Well, even when you see people speak about this on the orthodontic side, there's such a focus on extractions, whether you extract or not, this defense of extractions as a treatment plan. And it has nothing to do with extractions. It has nothing to do with orthodontics, really. It's dental facial orthopedics. Mm-hmm. And so what I would say is, let's come together to talk about mid-face development and how the face functions, and worry about lining teeth up afterwards. But this really is not an orthodontic lecture. It's dental facial orthopedics. I call it mid-face development. But, by your encouragement, I did 3 board certifications.
Yep.
The ABO, the American Board of Orthodontics, there's hardly anything on there about dental facial orthopedics.
Yeah.
Right? There's no cone beam. There's no skeletal expansion, nothing. And then I did the American Board of Dental Sleep Medicine, and there was very little about expansion in there. There was some orthodontic stuff, but the orthodontic paper that's still on the reading list discourages expansion with poor evidence, in my opinion.
Yep.
So that's a real challenge. So it's really not about teeth, it's about skeletal dimensions and functional airways and pharyngeal airway stability and functional nasal breathing. And so I'm looking forward to sharing what we're learning, and learning from what Dr. Rama and Dr. Kiefer have to say is just constant learning. And I'm very humbled to be invited. I know it's a great group. I love the meeting in Spokane. That was a great visit. And I love Notre Dame. So I'm looking forward to being there, and thanks for the invitation.
Awesome. Well, we appreciate you making the trip out from California, and look forward to seeing you in October. And thanks for all you do.